something's happened in the last 6 months, mainly because of the work and energy and leadership of key people who believe that this is the right thing to do. It's the right thing to move teamwork forward. It's the right thing for patient-centered care.
Across Toronto, there's a push to change the culture of healthcare. The provincial government has funded a major project to advance teamwork in 13 of the city's hospitals.
Our work is helping them really uncover what are we already doing around teamwork, what is already working, because a lot of this exists already in each of these hospitals. And then where do we want to go next? What is it that we want to create next that would really add value to patients, to families, to our work, to other professionals, and so on?
As we briefly visit 4 of the 13 hospitals, we'll see how the move towards teamwork is taking hold, from the bedside to the boardroom.
One of the things that really fascinates me is how well the physicians are taking it up. What's your sense for that?
Inside the University Health Network and its 3 hospitals, the cultural shift is being led from the highest levels.
Oh, that's good. I think leadership and interprofessional teamwork is crucial. I mean, the senior management of the organization needs to understand that this is a goal that the organization expresses and looks to accomplish in all the activities. So it's not merely putting this in a silo of activity. It's important for the leadership to recognize that interprofessional teamwork goes across everything the organization is trying to accomplish.
I think we need to get to the heart of patient care, so we need to really build skills and knowledge around collaboration and teamwork at the front line with middle management and with senior management. I think you need to look at that kind of micro, meso, and macro level all at the same time.
As with all those trying to embrace the new approach, the team at UHN are finding benefits and barriers.
The opportunity is the fact that we're a teaching hospital and we're essentially training the values in the people who are going to be recruited to work here in the next generation of care providers. So the enormous optimism is the fact that we're starting to teach people while they're obtaining their basic education and training around practice. We're teaching them and coaching them in interprofessional teamwork. The barrier is the fact that we've got a lot of folks working here who haven't had that advantage.
I think the most interesting challenge is one of tension and nervousness. So professionals initially get very excited about this area. It makes sense. But when you dig below that surface, what you hear is, what does this mean for me as a physiotherapist, as a nurse, as a speech-language pathologist? There's a little bit of concern about, is this about substitution and somebody else doing my role?
The hope here is that interprofessional care will make the patient safer and the health system healthier.
When we think about patient safety as an example, we know that a lot of our critical and severe incidents often occur because of communication issues. So even looking at how you can integrate teamwork and collaboration can improve some of the major things that we're thinking about in terms of patient safety in healthcare.
I think that if we're going to have publicly funded healthcare that provides the sort of care that Ontario citizens and our patients in University Health work are looking for, it has to be in the context of interprofessional teamwork, and we're committed to it.
In the rush of a busy emergency department, a patient's most basic needs can sometimes be ignored.
We'll maybe not get to spend as much time with the patient as we'd like to get the full story. You know, we have to prioritize all of the different patients' needs coming in the emergency department. So we're finding with time pressures, some of the basic stuff that isn't maybe so fancy or high tech is getting forgotten.
So Mrs. Massey's back again with her chest pain.
I know.
Longer than expected stays in the ED and a lack of communication between staff has meant some patients are not being fed properly or even given water.
A lot of nurses and doctors and whoever were guilty of starving our patients. I was in the acute room with a lady who was really off the wall, and they had to get a sitter for the night because she was just really confused and trying to get out of bed. And that's really trying, especially in an acute situation where you have patients that need your attention. And here's this one that really doesn't need you physically at this point, but mentally needs you and is demanding your attention. You know what? I went to that lady and I had fed her. She hadn't eaten for since the day before. I fed her, I fluffed her up, I talked to her, took some time to listen to what she had to say. That lady was good for the whole 12-hour shift, just from that little bit of, TLC that maybe someone else could have done that they didn't do.
The initiative here is about getting staff to work together to better meet the needs of older patients.
It's great to have teamwork because it's going to alleviate a lot of pressure knowing that I'm not solely the one looking after that person. If a patient needs to have a drink or needs to have something to eat, it's great that the porter would know that this patient, it's okay that they eat, that they can take the initiative to ask the nurse, is it all right if I feed that lady or gentleman? And it makes it a lot easier for the patient.
What we've realized here is that everybody needs to help. That means me. I'm not above, helping the patient get up and going to the bathroom. The nurses who've sort of traditionally been tasked with these roles, but are orderlies or personal support providers here. Everybody in the team can participate in providing basic care to the patients, and it's about putting the patient at the center of the care and putting their needs at the center, not what we think our job should be.
Hello, Ms. Massey. How are you? It's Dr. Lee. What's troubling you today?
It feels as if someone's got their hand on my chest and pressing down sometimes.
The anecdotal feedback is that the new approach in the ED is helping.
Already we've had a lot of people come up and saying, I did that, the patient got better care, and I felt better about the care I was giving, and that's really important. Nobody gets into emergency medicine because they want to treat older people poorly. They're here because they like to provide great care. So when they feel that they've done that, that really contributes to their job satisfaction and keeps people doing the job.
What we'd like to do now is talk about each of your roles and what you would do to help Mr. Smith.
Toronto Rehab has a reputation for embracing teamwork and running interprofessional placements for students.
So the key things are for our students to understand their scope of practice and their role as a member of the healthcare team, and then see how their role affects the other members of the team, and to fully understand the other members of the team's roles.
I think having the opportunity to work within teams with different students as well as professionals from different professions across the healthcare spectrum, I think it really prepares you well for clinical work.
Take one hand off completely. It's just there in case.
I think it really allows the patient to know that everyone's on the same page and on their side and really looking out for their best interests. I think sometimes it can be a little frustrating from a patient's perspective when everyone is asking the same questions and trying to find the same answers. When you have that team setting and that teamwork environment, you can really focus in on the key issues without repetition, and you can allow the patient to realize that we're really here for you and we're really doing what we can as a team to look out for your best interests.
Our patients tell us that when they have a team that works effectively together, their care is better. They feel that their team is communicating better together, and therefore we're anticipating to see shorter lengths of stay and less complications.
With resources from the Provincial Ministry, Toronto Rehab is now sharing its approach to student placements.
I think what's exciting about this grant is that we've been able to develop our program and modify it for other hospitals. So we've been able to partner with other hospitals in the city like Bloorview Kids Rehab, University Health Network and St. Michael's Hospital to help them to develop a program similar to what we've done. And we're building on our 3-year history to help to develop that kind of program.
When I was a medical student, we didn't have anything to do with nursing students or pharmacists or physiotherapists of any sort. So we actually didn't know what they did. We didn't know what the scope of their practice was. So when you go into practice, you actually don't have an understanding of what they're capable of doing. And it takes a while to figure that out, and maybe in some ways you never figure it out.
Now a senior manager, Bob Howard sees the value of a more collaborative approach.
If you're a patient, you would like to think that every healthcare professional who walks in your room knows what's happening to you. If they're all communicating through a chart, they all sit down and just kind of write their ideas on a chart and hope that the other healthcare professionals are reading their notes, and that's all they do, then there's huge opportunity for communication gaps about you, the patient. It makes a lot more sense that they actually sit in a room or stand in the hallway as a group and discuss you.
One strategy for getting different professionals talking to each other is a new mentorship program.
We've matched mentors and mentees with non-like disciplines, and people were enthusiastic about that. We had over 100 applicants to be mentors or mentees for only what we'd planned as 60 spots. And we have this great opportunity for a nurse to be matched with a doc, for a physiotherapist to be matched with a social worker, for a dietitian to be matched with a chiropodist. It's just great.
Alongside the enthusiasm at St Mike's, the team pushing change has also encountered some important challenges.
I'd say a big barrier was the misconception of some disciplines that if they partnered and were collaborative, that might mean that they lost something, that they would have to give away something that they already had to someone else. I just think it was a lot of wanting to be sure that their place as individual disciplines were secure in the system, and recognizing that there is uniqueness in each discipline, but the full depth of what you can offer a patient is only in the context of the collective team. That wasn't lived, but we're on the road for it to live here like that.
Things are moving at St Mike's, but the complexity of healthcare means that meaningful change may take some time.
So teamwork is something that, as a hospital, we would like to promote on our clinical services. To suggest that we're doing that perfectly would be false. So we still have issues in hospitals getting our different healthcare professionals to work together on highly functioning teams. It's not so easy in all instances. In fact, this is probably a long-term sort of project. This is not a quick fix, even though it seems like a great idea, maybe intuitively obvious to people that, you know, we would all be doing this. It's in fact not so simple, and it's probably going to take us years to kind of get where we think we want to be.
The regulation and legislation might take 3, 5, 10 years, but I think we can make some substantive improvements very easily with the resources we have now, with attitude and beliefs and cultural shifts. And I think the time is now.
The evaluation of all these hospital initiatives is being led by Scott Reeves, though its scope is limited.
For this project, we've focused in on the project leaders, the facilitators, and also the learners. The patients, because of the timescales so tight, we haven't actually had time.
We're not going to get to the patient outcomes, but we are going to be able to find if there is a difference within the people who have participated in the initiative in terms of their willingness, their attitudes, their belief and values for interprofessional care.
The next question is how to sustain the emerging change.
How do we inspire people? How do we engage people in a way that there's energy for this that will keep the momentum going? Because so much of this work is about sustainability. If we just say, hey, let's work together as teams and it's the flavor of the month, it goes away. But sustainability comes from a real core belief and real core energy. This is important, we care about this, and we're willing to do what it takes to make it happen.
We don't have a structure into place. We don't have interprofessional care leaders in each of the hospitals. So one of the challenges is that the good work that was started, the investment of citizen dollars for the initiatives that we put into place, will be gone. I think that'd be a real shame. How are we going to sustain the cultural shift that's occurring?